Our episode topic is current trends in home based healthcare. My guest is Dr. Andrew Agwunobi, a physician and president of Home Solutions at Humana Incorporated. So let's get started.
Welcome to the BRG Nurse Executive Podcast. BRG is a global consulting firm that helps organizations in disputes and investigations, corporate finance, and performance improvement and advisory. BRG's healthcare performance improvement practice offers multidisciplinary services to healthcare organizations. We focus on implementation with innovative, independent, and data-driven solutions. In the BRG Nurse Executive Podcast, we discuss improving patient care by advancing nursing leadership. For more information about BRG, please visit thinkbrg.com. Now here's your host, Nick Chmielewski.
Andy, thank you so much for joining us today.
Thank you. It's a pleasure. Great to be with you.
Would you tell us a little bit about yourself, what drew you to Humana, and in particular to working in the home health arena?
Having spent my career in running hospitals and integrated delivery systems, I was really attracted to Humana's vision to make care in the home the center of care for individuals, for people, and to really make that a value-based care model as well. So that's why I joined Humana, and I've been there for a year and a half, and it's going very well.
And so as we look forward to the future, what's your vision of home-based care in the U.S.?
My vision is that the home is the center of care. It's not the only place where you get care. Obviously, you get care in hospitals, you get care in primary care clinics, etc. But that home becomes a central point, and that there are that many conditions which are currently treated in other facilities, more expensive facilities than the home, are now treated in the home, and that we bring technology into the home to enable the treatment of conditions. And basically, at the end of the day, patients are able to get access to care on their own terms in the most familiar setting and in a place where we can take the whole viewpoint of the patient. For example, social determinants of health. Does the person have electricity? Does the person have water? Does the person have a social support network? How are they doing from an isolation standpoint? That we take all of that and we incorporate that into their care. Because one of the things that studies have shown is that only 20% of healthcare outcomes are due to the clinical care that we deliver. The rest of it is due to improving social determinants of health. And so that's an important viewpoint as well.
So what role does value-based care play in home health? And what does that mean for both clinicians and as well as for patients in receiving that care?
Value-based care is when we start thinking about not just the transaction. So when you think about fee-for-service care, you come in, you want an X-ray, you get an X-ray, you pay for it, or the insurance company pays for it. Or you need a clinic visit because it's an annual wellness check. You come in, you get that visit, insurance pays for it. This is more about looking at the whole person and their whole experience and saying, I'm going to take responsibility for making sure that the person is well throughout the year and even beyond, that they don't end up in the hospital when they don't need to be there. They don't end up sitting in the emergency department for 3 hours when they don't need to be there, and that the care comes to them in a way that they feel satisfied with it. And so it's really about making sure the care is delivered at the right place, at the right time, and at the right cost. Lots of studies have shown that giving care in the home is less costly, it's the same quality, it's safer. There are less falls in the home than there are in the hospital. There's less infections that occur in the home. And you can also take into account the social determinants of health. Does the person have electricity? Does the person have water? Do they have a fridge to cool down their insulin? Whatever it might be. And so value-based care takes a holistic approach to the patient and makes sure that it's at the best quality at the best cost. And so the home is critical to that. And that's one of the realizations that has happened in the industry over the last 5 years or so, is that if we really want to get to value-based care, we have to have an attitude that says patients don't go to where we have assembled all of our assets, like hospitals and outpatient surgery centers and everything. The care should come to the patient in the most affordable, most convenient. I can have my pet at home while I'm in there. I can eat, I can walk around. I don't have to be in a bed all the time. I can walk around my home. I can eat my own food and things like that. That is all part of the holistic nature of care.
Going to the emergency department is like the easy button,
Yeah.
right? It's an easy button to when there's access to care problems. It's an easy button to subvert a prior authorization sometimes that may not be done intentionally, but we know that it happens. In your work in home care, how do you enable and ensure in a culture in the US of immediacy an ability to provide the costs at a lower function and almost dissuade that practice from happening so that the patient stays in the home, they are in the home, they're receiving care in the home, or maybe on an outpatient basis for the follow-ups and not using that easy button unless
Yeah.
absolutely necessary?
It's about demonstrating that it can be done and that it's actually better when you do it in the home. And to do that, by the way, some of our listeners may be thinking of what is home health care. And yes, it is the care that sometimes a lot of elderly people get in the home, or people who have had a broken hip or something in the hospital and they're sent home and they get rehabilitation in the home, they get nursing care in the home, etc. That is the traditional home health. But what we're talking about now is what I think of as enhanced home health. So bringing technology into the home, for example, that allows for the same level of care. For example, bringing dialysis into the home, imaging, x-rays can be done in the home, infusions can be done in the home, meals can be brought to the home. So, and through telehealth, through virtual modalities, we can bring physicians into the home, we can bring nurse practitioners into the home. And so having people understand that there are many conditions that can be treated in the home just as well as they are treated in the hospitals. So you think about cellulitis, pneumonia, COPD, you think about urinary tract infections, and hospitals have realized this over time. There are so many conditions that are current that used to be only handled in the hospitals that are now handled in outpatient centers, joint operations, things like that, right? And a lot is moving from the hospitals and even from the clinics into the home. But we have to demonstrate to people, and we are doing that, and a lot of other companies are doing it too, demonstrating that you can get this care in your home. And what research has shown is that people are extremely satisfied, over 90% satisfaction rates and high 90s in some cases with getting their care in the home. They can almost not believe it that I didn't have to wait 2 hours in the 4 hours in the emergency department. I got it in the home. By the way, it's less cost, it's just as good, and it's customized to me. But yes, we have to demonstrate to people through technology, through workforce, through education, that it can be done in the home and done better. And by the way, from a cost perspective, Brigham and Women did a study that showed that if you do what they call hospital at home, which is some of those conditions I'm talking about that would have been treated in the hospital, or the ED actually happening in the home, that those are 38% less costs. Johns Hopkins has shown similar numbers in its studies, much less costly, great patient satisfaction, and the outcomes are at least the same. And we have to demonstrate that to people. We went not to think we went from, if you remember, and I'm dating myself, maybe before your time, but when people had to go to a video store to buy a video, or you could only watch it in the movies.
Yeah.
Now it's streamed into your house through Netflix or whatever. That's the kind of change we're talking about, that having people understand it is better to be in the home for many conditions. Not all conditions. I ran hospitals, and hospitals are extremely important. But many conditions that we think we need to be in the ED for or the hospital for, we don't. We can do them at home.
So clearly, experience is part of it, but also quality and ensuring that the quality is at least the same. You mentioned that earlier. What is Humana doing to ensure top level quality for the patients that you are taking care of?
This is a very highly regulated field, home health, and making sure that We're complying with everything and even exceeding the needs of regulatory needs around CMS, Center for Medicare Services, et cetera. But one of the ways that we're making sure is making sure that we're really investing in our staff, in our nurses. This isn't about taking care away from the bedside. This is about adding technology and processes, et cetera. So, for example, um, we have an application that we have rolled out called Invoke, which is speech to text, and it's allowing nurses to just record the documentation, have that go straight into text, so they don't have to sit and be typing while they're talking to patients. It has shown that it adds time. It allows more time for the nurse to be able to focus on the patients. We also have what we call STARS scores, which is looking at it's a patient quality of care scores, which include things like timeliness of getting out to see the patient. It includes making sure the patient can ambulate. It has a number of quality measures associated with it. And I'm proud to say that, for example, CenterWell Home Health in Humana has a score of 4.22 over 5, which is one of the highest in the industry. Really just making sure that we're focused as much on quality. Value-based care is about quality and cost and affordability, right? Focusing on all of those aspects.
As we think about an aging population and increasing demand for these home health services, how is the shortage of nurses and clinicians affecting your operations?
Yeah, it's an industry-wide challenge with shortage of nurses right now. And what we're having to do again is to make sure that we're automating as much as possible, not to replace nurses. You can't replace nurses. We need them to be at the bedside. It's actually regulatorily required that they be at the bedside, nurses and physical therapists and occupational therapists, et cetera. But automating to allow them to have less windshield time. So when they're driving, make sure that the logistics are such that they're spending more time with the patients than they are on the road. Making sure that the scheduling is right so that they're going out to see the right patients and you're making that as efficient as possible. I talked about taking away the burden of documentation, which is a huge issue that nurses face. Flexibility in their scheduling so that flexibility in their work, not just their scheduling, but in their work so that if someone wants to do part-time versus full-time, that you're taking that into account. And then something that's very important, not just for nurses, but for everyone else in that works, and that is to have a voice. And so we have a very strong within Humana, strong shared governance council, nursing council under our chief nursing officer to make sure that the nurses on the front lines, their voices are heard as we make decisions about their work and about the patients, et cetera. So just being very proactive in making sure that we become and we are the best place for people, for nurses to work. And that's something that all organizations are doing right now because they're such a critical resource.
Is there anything that Humana is specifically doing to support nurses to learn about and enter home health as their practice setting?
So this kind of refers to pipeline, for example.
Yeah.
So we're doing some work with Emory University. We've helped co-sponsor a simulation lab, which is basically a laboratory which exposes nurse students to the home health industry. And it's one thing that I didn't realize until I got into this side of the industry was that nurses are not really exposed to home health when they go through their training. And if you think about it, when you're out there often on your own in a home, it's extremely rewarding. If you talk to nurses that do this all the time, it's an extremely rewarding business where you get to sit with a patient that you've gotten to know over time and help them to get better. It's just amazing. But it's also challenging because you're on your own. You don't have a team of people like you have in the hospital. So having a simulation lab where they can be exposed during their training to the home and to understand what that means is really important. But also making sure when they come on board to a home health organization that they're supported by mentors, what we call clinical educators, people that you do ride-alongs so that you with a senior experienced nurse so that you know what you're getting into and you can ask questions and help is only a phone call away. So there's a lot that has to be done just to make sure that we're supporting our great nurses as they go out in the field.
Yeah. Thinking back nearly, gosh, 20 years now, I had very limited exposure to home health nursing. I think I went out with 2 nurses
Yes.
for 2 days, and that was about it. Are there any other strategies that you're doing to try to introduce, nursing careers and specifically home health careers that are out there, earlier as people are considering healthcare as a profession?
Yeah, we're doing a lot of things like national interview days where we educate out there. We're making sure that we go out and we have our nursing team speaks in different venues at schools and conferences and things like that to make sure that we educate people. There's a lot of material that people can get when they come to our website and land there for jobs. But essentially, I think it's mostly once we from the pipeline, obviously, there's a lot that comes in the pipeline, but it's a lot that happens in the training out in the field. But ultimately, when people come in, that's, I think, when we have the best opportunity to expose them to what home health means.
What role does culture play in building your clinical workforce, and how do you enhance culture for nurses in the home health setting and in other settings as well?
Yeah, we culture is really important. Whether it's a hospital or whether it's home health, culture is essential. That's why, for example, magnet designation for hospitals, I think is so important because you have shared governance, which is really important. You have the profession of nursing, which is really important. And we make sure that we participate in conferences around that and in groups around magnet. But we also make sure that we take some of those lessons and we inculcate those in our nursing workforce. So we have a nursing workforce governance council within Humana. We make sure that we support our nurses, we listen to them. As I said before, they have a shared voice. So it's really important and they support each other. So I think that recognizing nursing as a profession, recognizing that there's no home health without nursing. You could talk about there's that yes, there's physical therapy, etc. But really, when I'm talking about the vision for home health for the future, when we talk about value-based care, we talk about, for example, higher acuity care in the home. When I mentioned about things that you can treat in the home that are currently treated in hospitals, etc. And when you talk about bringing technology into the home, nurses are essential for all of that. And so recognizing their value, giving them a voice in decision making is all very critical.
Looking ahead into the future, what role do you see for technology and innovation in home-based care? And any pearls of wisdom or things
Yeah.
you wanna share around that?
So there's technology around clinical care, right? So there's technology around imaging, as I mentioned, infusions, telehealth to bring specialists into the home, and the other sort of modalities that are necessary to have a hospital at home. Everything that you would think you would need in the hospital, telemetry monitoring, etc., is important. Other monitoring are things like remote patient monitoring. So being able to, which we've known about for a long time. If you think about cardiac patients in the home who weigh themselves every day and that weight is remotely transferred to a central hub, or pulse ox saturations that are remotely transferred to a central hub. Those are the basics, but there's so many different types of monitoring that can be done right now on patients in the home. So that's another area that's extremely important. But the other area of technology is really about the workflow. And as we've talked about, the nurses and the physical therapists around logistics and to make sure that everybody is operating at the top of their license. So taking as much documentation away from them so that they can be present in the home and not have to take 2 hours of documentation back to their own home in the evenings, right? And so I think there's two sides to the technology, but certainly it's what's really exciting right now is there's so much clinical technology available that we can apply in the home that has never been applied in the home before.
If I'm a chief nursing officer and I'm listening to this episode right now, and I'm thinking, this sounds well and good. My biggest problem right now is getting some difficult discharges on the inpatient side out. And in
Right,
some cases, I want to get them home, but I'm having a hard time making that connection and that referral link. It's just not jiving the way it should. Any advice you have around strategies to open up that freeway, so to speak, so that we
right.
can get those patients out of the hospital and into home-based care more quickly?
One of the things I would say is it's really there's the micro level problem, and that's making sure that you have the technology to be able to interact with the home health agencies. But that's something that hospitals and discharge planners have done for years, right? And it doesn't work exactly right, as you've said, in all cases. But I think the solution is more a macro solution. When we talk about value-based care, if you think about what's happening now in the industry, and I haven't talked about this yet, you think about the fact that the industry of home health is and used to be fee for service, right? So that we described before, which is very transactional. What's happening is original Medicare, which is the biggest fee for service payer, is now declining in numbers, and Medicare Advantage, which is a value-based payer typically, or at least aspires to be a value-based payer, is going up. So what that means is Medicare Advantage companies like Humana, what we're really interested in is connecting primary care, hospital care with home health care, and having that all be a package of care for the patient so that we get the quality to be the best it can be and the cost to be the best it can be. So what that suggests is that there's an opportunity. Home health agencies have already realized this. There's an opportunity to partner with payers to connect all of that up. So connect up your electronic medical record in the hospital, make sure it's connected with the primary care, both your own primary care and other primary care. Make sure that's connected with your home health. Make that a seamless connection for plans members. And that will help immensely when it comes to making sure that referrals go to the right people and that it's in the right context. It doesn't solve all the problems, but it's the next step upwards in seamlessness and integration. So I think it's really about integrating the systems so that we all have a full view of the patient. And then when you're discharging the patient, the context, who the primary care physician is, who the plan is, who the home health agency that the plan prefers is, and it really all connects it all together.
Excellent. Any closing thoughts as we wrap up this episode?
The one thing that I didn't realize when I was purely on the hospital side, and by the way, I love hospitals. I think it's all part of one continuum. When I was purely on the hospital side, I didn't realize two things. One, how important the home was in the overall care, not just in the rehabilitation after the bone breakage or fracture, but the overall care of the patient and how much you can glean from that. So I would urge that, especially on people on the hospital side, but also on the home health side, understand that it is a central fulcrum. It's the home of the patient. It's where the patient exists. So it's the fulcrum of care, and so much can be done there. And so I think that's the main thing. And then the other thing I didn't realize is that nurses are so much in demand, not just in hospitals, but in so many areas, whether it's home health, utilization management, technology companies, etc. And we all have to put our heads together to make sure that we're exposing nurses to the right careers, to all the careers, and that we're working to make sure they're not just compensated fairly, but that they have a work environment that they can really enjoy.
Andy, thank you so very much for talking all things home health care in the United States. I appreciate your time.
I've enjoyed it. Thank you.
You've been listening to the BRG Nurse Executive Podcast, which focuses on improving patient care by advancing nursing leadership. The views and opinions expressed in this podcast are those of the host and podcast guest and do not necessarily reflect the opinions, position, or policy of the guest employer, Berkeley Research Group, or their other respective employees and affiliates.